The male genital organs and urethra, and we're going to cover some clinical stuff relating to that. Varicocele is a condition characterized by the enlargement or dilation of the veins within the pampiniformis plexus. So it affects approximately 15% of males and can lead to low sperm production and infertility. So let's look at that. Remember that when we're talking about the pampiniformis plexus, it is located inside the funiculus spermaticus, or the spermatic cord. The spermatic cord is basically going from the annulus inguinalis profundus to the inguinal canal here, and then we have the spermatic cord, and then epididymis here, and then the testicle here in this, and you're actually seeing it all pretty clear and beautifully in this anterior view of dissected spermatic cord. And here you're also seeing the duplicated vas deferens. So the spermatic cord contains plexus pampiniformis, which is a venous one, plexus testicularis, which is a nervous one, 3 arteries, testicular artery, ductus deferentis artery, and crema satirica artery, and then also contains ductus deferens. And then actually also contains the genitofemoralis nerve. Okay. So anyways, the point here being that the plexus pampiniformis is inside the funiculus spermaticus, and the testicular artery also. And these two together regulate temperature for production of sperm. So in the case that we have testicular atrophy, size reduction of the testicle and function, this is often due to varicoceles, we can say that this is due to veins in the pampiniformis plexus is swollen. And as I said, due to the fact that these are responsible for regulating temperature with the testicular artery, testicular atrophy is not good at all, right? So that is the main point here. Swollen pampiniformis plexus, dilation of the pampiniformis plexus inhibit good temperature regulation, and therefore the production of sperm is gonna be bad. Secondly, we need to remember that the plexus pampiniformis on the right side drains to the right testicular vein, then to the inferior vena cava, and then to the right rene. However, for the left side, the plexus pampiniformis drains directly to the left testicular vein, and then to the left renal vein, and then to the left rene. And due to the fact that they have different drainage, the testicular vein on the left side passes in front of the descending colon and can be compressed, and therefore we're saying that most varicoceles occurs on the left side. In fact, 90% of them occurs on the left side. Then we have torsio testes, also known as testicular torsion. This is a twisting of the spermatic cord and rotation of the testes. So this is often triggered by activity as seen in teenage boys and requires immediate surgery and attention due to the fact that we have no blood supply to the testes, which then can lead to infertility and death of testes, even necrosis of testes. So this is very acute. Now, hydrocele testes is referring to the fact that in the innermost layer of the testes, we have the tunica vaginalis testes, and that contains the visceral and parietal layer. And inside here, if we have fluid accumulation, that refers to hydrocele testes. By the way, remember that tunica vaginalis testes is derived from peritoneum, and after that innermost, after the tunica vaginalis testes, we have the fascia spermatica interna, then the fascia crema satirica with the muscle crema satirica, and the fascia spermatica externa. Then we have epididymitis, which is nothing more than inflammation of the epididymis. Remember that the epididymis stores and transports sperm to vas deferens. And epididymitis is often due to sexually transmitted infection, urinary tract infections, or other infections, or even trauma. Testicular cancer is the most common cancer form in young men aged 15 to 35 years. Fortunately, if treated right, we have a very high cure rate, and the survival rate for testicular cancer is more than 95%. Then we have exploratio rectalis, and if we want to explore the rectum, we need to remember the relations. So anteriormost we have the pubic symphysis. Here we have the vesica urinaria, the urinary bladder. Inferior to that, the prostate gland, and then most posteriormost we have the rectum and then the anal canal. So in examination of the rectum, we're also examining the surrounding structures, assessing the rectum and the prostate. And when assessing the prostate, we're either looking for benign prostatic hyperplasia, so meaning that the prostate is enlarged, or prostate cancer. If we have enlarged prostate, which is very, very common and seen in almost all older men, 50 years and older, it makes it harder to pee because the prostate is enlarged, so the urethra here is compressed. As you see, the urethra is compressed due to the fact that we have enlarged prostate. So they oftentimes have peeing problems. It's hard for them to pee. Then we have the prostate cancer, which is a whole different thing. And in assessing this, we're looking for the size, we're feeling for the shape and texture, and any abnormalities, tumors. And here we need to remember that when we're talking about this, we have three concentric zones of the prostate, innermost being the transitional zone, then the central zone, and then the peripheral zone. And prostate cancer always occurs in the peripheral zone. And the transitional zone, with the mucosal glands, we have benign prostatic hyperplasia. Urinary catheter, we're using a tube and inserting it through the urethra into the bladder to drain urine. Okay, so this is known as urinary catheter. And here we need to avoid forcing it through, because if we're forcing it through, particularly the pars intermedia urethra, that can cause a rupture here. And we need to know that we have a sphincter muscle, the external urethra sphincter muscle here. And so if we're forcing it through, well, we can have what is known as uroplania, meaning that the urine leaks outside the urinary system. And so we need to make sure the patient is very relaxed, so that the muscle is also relaxed in the pars intermedia, the sphincter muscle. And lastly, we have hypospadia and epispadia. Epispadia is urethral opening on the dorsal surface, and hypospadia is urethral opening on the ventral surface. Instead of the opening of the penis is on the inside, it should be on the tip of the penis here, not on the inside or the outside. It should be neither on the ventral surface or the dorsal surface. It should be right at the tip here. So this is hypospadia and this is epispadia.